Good morning, everyone. Happy Friday Eve. My name is Monique Jones. I'm the president and CEO of Forefront, and welcome to our webinar communication conversation discussion about how stronger public-private partnerships in Illinois can benefit the state, the sector, and communities. We are looking forward to the next 90 minutes with you. We have it in this way so that you can see each other. We do have the chat feature and the Q&A feature open. We ask that you place any questions in the Q&A and our team will monitor it and get it to the appropriate person to answer before the end of our webinar. And in the event that we can't answer them all, we will certainly not just ignore them. We'll try to send out some responses. So for the sake of time, I want to get us started and then pass it on to the rest of the team who's going to give you some very, very valuable information about why private-public partnerships are so important. And we're hoping that you are agreeable with us. So again, Monique Jones from Forefront. Forefront is Illinois' statewide association for nonprofit and grant makers in Illinois. I said that for Illinois State, right? But we're guided by our one goal to create a united and thriving social impact sector that has transformative impact on the well-being and economic security of communities and promotes equity across the entire state. To achieve this one goal, we provide a wide range of services and programs, including our upcoming Grant Makers Institute. So we haven't seen that, be on the lookout for it. Our library services, we have networks and best practice sharing programs across events. We have a racial equity collective that just announced its first cohort. And of course, we do our public policy and advocacy work. This is all driven by a strategic plan that my board adopted 2 years ago, which prioritizes our statewide presence and reach, collaboration to address our most pressing issues, and racial equity across all of our work internally and externally. We're also committed to leading in the development of public-private partnerships, which is what has brought us here today. In our 50-year history, we have a commitment of public-private partnerships. And so if you have been with us for at least the last 10 years, you'll recall that we were a leader and the convener for Count Me In Illinois for 2020. And I can't believe we're gearing up for our next census, but we did that. And that partnership brought together funders statewide with state leaders to coordinate outreach and work to increase the self-reporting of the 2020 census. We were able to work to be the state with the highest self-reporting rate among large states as a result of this partnership. And we're very, very proud of that. And we look to do that again. So having seen the power of partnership in the census, we put forth a new plan for that to happen this year in our 2020, last year in our 2023-2025 strategic plan. So if you have had the luxury of seeing our 175-page plan and want to dive deep into it, we have some specific things in there that guide us towards how we want to approach this. And so we've spent some time researching and learning, and we understand that we need to understand more about how to develop partnership structures in other states. And so this event brings together experts that we've identified locally and across the country to share some best practices and ideas. So today you'll hear about what we've learned. At the end of today's event, you'll hear a call to action of sorts from our wonderful board chair, Maria Pesquera. And then we'll also have time to answer questions and take on comments that you may have. So I appreciate you being here. I appreciate your time and appreciate your thought leadership with us today. And I am going to turn it over to our Policy and Government Affairs Coordinator, Alec Lapata, to do the rest of our introductions for our speakers this morning.
Awesome. Thanks so much, Monique. So today we have three really incredible speakers that I want to introduce and then give them a chance to introduce themselves as well. So first we have Karen Aldrich Eason, who is the first foundation liaison to a governor's office in the United States, who was appointed in 2003 as a loan executive from the Charles Stewart Mott Foundation to the governor's office in Michigan. Established through a joint agreement between Michigan Foundations and the governor's office. She has developed and assumed responsibility for this new position in her over 20 years since then. She is charged with bringing together state policymakers and foundation leaders to explore and identify solutions to issues affecting Michigan families. Then we have Kathleen Kelly Janis. who is an expert in social innovation, philanthropy, and public-private partnerships. As a senior advisor to Friedman Consulting, she provides strategic guidance to charitable foundations and advances cross-sector partnerships. Kathleen is also a Stanford University lecturer, where she has been teaching international human rights and social entrepreneurship for 15 years. And most recently, she served as a senior advisor on social innovation to Governor Gavin Newsom in California. And finally, we have Jackie Rosa, Chief Philanthropy Officer for the City of Chicago. Jackie is a lifelong Chicagoan with nearly 2 decades of experience in the nonprofit and philanthropic sectors. She brings a breadth of experience, including equitable grant making, place-based investment, and community and civic engagement. Serving as Chief Philanthropy Officer for the city, she leads philanthropic partnerships in the mayor's office to support investment and funding for key priority areas to improve the quality of life for all Chicagoans. Previously at the United Way of Metro Chicago, she led philanthropic investments in 18 communities across the city's south and west sides, including suburban Cook County. She mobilized the corporate and philanthropic sectors, nonprofits, small businesses, and community leaders around common community goals to build a stronger region, and was the recipient of the 2016 Hispanics in Philanthropy Next Generation Fellowship. So thank you all so much for joining. I want to give you each a few minutes to talk about your experience in the public-private partnership space and what you're doing now, and then we'll move into a moderated conversation with Karen and Kathleen to start. Karen, if you want to start first.
Thank you, Alex, and thank you, Monique and the team at Forefront for this opportunity to chat with you and your colleagues in the Illinois area today. Want to just introduce my colleagues who are on with me, Dana Lene, who is our Director of Research and Planning, and Amber Belazar, who is our program officer, and I'm going to invite both of them to help me by putting things in the chat that might be applicable to the conversation as we go through. I guess I'd say about my personal experience. I spent significant amount of time in state and local government as well. And one of the things that I noted during my tenures in those fields is that often we worked in silos. We worked alone without information about what was happening or the impacts of the work that we might be doing on communities, on families and individuals. And so the opportunity to move from government to philanthropy, I thought offered a chance to be more engaged with community, but still the silos existed. Philanthropy worked in its own silos. And so when this opportunity occurred back in 2003, for those of us who've been around a while, you may remember that that was when there was an economic downturn across the country. And in the Midwest in particular, the auto industry was hit very hard, very hard. And for the first time, I think in many foundations' history, they were making cuts as well. I recall the W.K. Kellogg Foundation, where my colleague Dana comes from, laid off employees. It was unheard of before. And what philanthropy was deciding at that point was that they didn't think it was such a good idea to continue to operate separately when many of the goals were the same between philanthropy and government. And in Michigan, we had an earlier model of a partnership office in Detroit under Mayor Dennis Archer. And there were some things that they learned from that experience that they wanted to adjust as they thought about a state office. And they took this idea to then Governor Jennifer Granholm, who is now Secretary of Energy for the Biden administration. So I would say working in local government, working in community and doing grant making at the local level, as I did when I was inside of the C.S. Mott Foundation, really honed and taught me more about the importance of partnerships and collaborations and hearing from folks who would be impacted by decisions and policies that government might make. And then just the ability to leverage your resources, not only your funds, but also your knowledge resources across the sectors. We have learned over the years that you can do so much more and have so much stronger policies and programs if you work together, particularly starting early on. Our office, the Office of Foundation Liaison, is structured with an advisory committee. Our advisory committee is funders. All of them fund our office. They are strong advocates for our office and the work we do. We have 3 priority areas that adjust based on what's happening in reality in government and people's lives and communities, as well as administrations. It's in the P20 space, including early childhood. It's in health outcomes, and it's in opportunities for workforce and economic success for families and communities. We are nonpartisan, so we have been able to cross 3 different administrations, starting with the Democratic administration, then transitioning to a Republican administration, and now again back to a Democratic administration. We are funded in a way that allows our funding to cross over the terms. So we are not fundraising when a new governor comes in. We actively, our members and our advisory committee actively talks about this office during campaigns to let those who are the candidates for the governor's office know that the office is there, why it's there, and how it can be helpful to them. What we do a lot, and I was thinking about this, and I just wanted to pull up some key words that really, I think, help to describe our office. We are a neutral convener. We're unifier. We're often an influencer or an intermediary. Sometimes we're a knowledge broker. Other times we're a matchmaker. We are a relationship builder. And we are a truth teller and a collaborator and often a questioner. And so those are just a few of the words that I think help to describe what we do in our office. The office is located physically within the governor's office, and we think that's a key strength of the office. We are down the hall from the governor's policy team, which allows us the opportunity to frequently communicate with that staff as they are thinking about policies for the governor. Not after they're developed. And we have recently even worked with the state budget office as they are developing the budget, the next budget, to talk about where are there opportunities for philanthropy to partner with the state on priorities that they hold mutually. So I think that's a key thing that we've had. It was difficult for us during COVID not to be down the hall, not to be able to catch people at the coffee machine or the water fountain and just chat about them, or have them drop in our offices casually. Dana and I've learned that often it's a good thing to stay after 5 because you'll get a drop in just to say, hey, I got this idea. Can I bounce it off of you? Would this be something philanthropy would be interested in? Or, hey, I have this idea, but I don't know much about it. Or the governor is thinking about this, but I don't know much about it. Do you have anyone in philanthropy who might be helpful? So we might, in fact, connect them to a program officer or VP at a foundation, or we might ask that program officer, who do you have in your grantee pool or consulting pool that might be useful to the development of a strategy around this? A recent example is the governor wanted to do something to help caregivers in our state, particularly those who are caring for seniors. And the policy advisor said, I don't know a lot about this space. We were able to connect them to the Ralph C. Wilson Foundation, which has a portfolio around caregiving, and have, staff who have been deeply engaged in this work for almost 10 years now. So that's a way that our office can be immediately helpful. We're often helpful to small foundations who don't know where to go within state government if they're trying to help solve a problem for their community. And so we are a source of sort of a central point that they can come to, almost like a clearinghouse, and redirect them to where they may have the best success. We work with state agencies around developing plans. I noted some recent things that we've done. For example, we helped to inform the state housing plan by identifying funders who are in our rural communities so that they could have a conversation with the state around what it means to include rural communities in the housing plan and what their needs look like that might be different from some of the urban communities. We also are currently informing the state workforce plan by identifying foundations who've done grant making in this space to help the state create a really strong workforce plan. We were an intermediary during COVID, passing information back and forth between philanthropy and state government. Philanthropy during COVID was much more nimble than the state around getting laptops into communities, into schools for kids, creating hotspots so that kids could connect, and also getting food to places where there's needed. Philanthropy was also getting cash into the hands of families that didn't have jobs. And this was prior to the feds ramping up or state government ramping up to do a number of things, because it took time for those systems to ramp up and philanthropy could act immediately based on the knowledge they had. Alex, how am I coming on time?
I was just going to say, let's do the other introductions, and then I want to ask you more about all of this in our moderated conversation in just a minute.
Okay.
So I'll pass it over to Kathleen to introduce herself as well.
Well, good morning, everyone. Thank you so much for having me. I was getting my kids ready out the door this morning here in California, and I said I was giving a speech in Illinois, and they said, "You're going to Illinois? Don't leave us." I said, "No, it's great. I get to do it over Zoom." So what a wonderful world that we live in, that we can be in community from so far away. So as Alex said, I spent 3 years as a senior advisor on social innovation to Governor Newsom. And like so many of you, I've spent my entire career trying to figure out how I can leverage my talents and my resources to make the most possible impact in the world in the short time that I'm here. And as a lecturer at Stanford, I spent many years studying how nonprofits scale. I wrote a book called Social Startup Success, which highlights dozens of change makers and how they scaled their organizations. But after all this work, I realized that even the most successful organizations with the most creative ideas for how to improve the lives of communities were only reaching a sliver of the population as a whole. Private sector efforts, whether it's spearheaded by philanthropic organizations or nonprofit leaders, or even some of the largest companies in the country, are always going to be a drop in the bucket when compared to huge government programs. And while government programs may be huge, they need, as Karen said, the nimble nature of the private sector to innovate, to move more quickly, and to so that they can bring new ideas to scale. So in short, we need both. And I truly believe that public-private partnerships are the way of the future. When you practice social innovation inside of government, the potential for scale is both immediate and exponential. So I went into government service to transform this conviction for public-private partnership into meaningful change. In 2018, in November, Governor Newsom was elected as the governor of California, and he appointed me as part of his transition team to lead a group of experts to identify ways to leverage innovation for social change. Of course, one of the first calls that I made was to Karen Aldridge Easton in Michigan, who had been doing this work for years, and so grateful for her leadership and for her mentorship as we were building this office. And one of the ideas that we pitched to Governor Newsom was an Office of Social Innovation modeled after a similar office that President Obama had launched in 2008. Simultaneously, Philanthropy California, which is our statewide Philanthropy Alliance, representing more than 600 foundations, was lobbying Governor Newsom to appoint a liaison role in his office to build public-private partnerships. They wanted someone to be able to go to be able to help drive some of the policy initiatives and new ideas that they had. And so combining these ideas, in 2019, Governor Newsom appointed me as the first ever senior advisor on social innovation to lead public-private partnerships in California. The role is a cabinet level position that sits in the governor's office on the policy team among those who are making and implementing policy on everything from homelessness to workforce to climate resilience. So initially, this was not the structure we had intended. We were thinking this kind of like office that could be separate. But actually, it turned out that being on the cabinet team ended up being super critical to advancing partnerships because I was working side by side with Governor Newsom's most senior policy advisor. So I was the first to know when key policy priorities could bring up opportunities for collaboration, or vice versa. I was in conversations with philanthropic and nonprofit partners that I could then bring into the governor's office and act as a translator, quickly connecting ideas and opportunities for partnership that I saw. A good example of this is a partnership that we developed in California called the Immigrant Resilience Fund during COVID. Just after the CARES Act was passed, Americans started getting these $1,200 checks in the mail, but undocumented workers were left out of that relief. And so Governor Newsom felt it was really important to give those workers the dignity that every other American was receiving of relief during the early days of the pandemic. Around the same time, I was in conversations with philanthropic partners, and I learned that the grant makers concerned with immigrants and refugees were also considering developing a cash assistance fund for undocumented communities. So this is where I was able to play that very critical connecting role. I asked if we funded this together and the state did something alongside philanthropy, could we up the ante and increase the amount that they were willing to raise and give? And so in in April of 2020, we announced a $125 million fund with $75 million in public funding, $50 million from philanthropy. Ended up being a $150 million fund because we got one of the McKinsey Scott grants to support the effort. And that fund supported over 230,000 undocumented Californians to receive one-time cash assistance of $1,000 per household. This partnership was so successful, it was replicated across the country. But to me, the promise of public-private partnerships is really the long-term policy change. It wasn't just this one effort of cash assistance, this $1,000 that went in people's pockets. That was very important. It helped people stay in their homes during COVID, but it also laid the foundation for California to end up bringing undocumented workers into Medicare for the first time in across the country, and also to make undocumented workers eligible for the earned income tax credit in California, which is also a policy first. So it's laying the foundation for the idea that undocumented communities also deserve dignity in our society and benefits for their important contributions. It's also, I think, a really good example of how this work comes together in practice. In this case, government and philanthropy very easily could have gone off doing their funds kind of separately, but because I was in that role and I was able to connect the dots and put that partnership together, everyone was able to have more impact by working together. So in total, with Governor Newsom, I helped build over 50 of these types of public-private partnerships, totaling $4.2 billion, impacting the lives of millions of Californians. But to me, it's not about the numbers, it's about how we did the work. And throughout the course of my time in government, we worked with 25 departments and agencies, over 202 corporate and philanthropic partners, and 1,600 community-based organizations to ensure that all of our partnerships were really grounded in community and community needs. And we built a muscle for public-private partnership that has lasted long past my tenure in the role. So I'll pause there, but really excited to dive into conversation.
Thank you so much, Kathleen. And between the two of you, there's so much I want to ask you, but I want to give Jackie a chance to introduce herself as well. And then what we'll sort of do is have a conversation from our out-of-state experts, and then we'll get to hear from Jackie about what's already happening at the city, even more than your first little salvo that we've got here. So Jackie, I'll give you a minute to introduce yourself and your work.
Hi, good morning, everyone. Jackie Rosa here at the Mayor's Office, Chief Philanthropy Officer. I've been in this role for about 7 months now. It feels like 7 years. Things move very quickly, but also very slowly in the Mayor's Office. I'm really grateful to be here today with so many colleagues that are also in the field here in Chicago. So great to see some familiar faces. And so much of what I do right now is exactly what Karen and Kathleen have been describing and talking about. You know, this role prior to me coming on board always existed, but it wasn't really formalized. Different departments, city departments, different deputy mayors, all connected with philanthropy at some point to really maximize investment and coordination of programming. However, there wasn't a dedicated role. And I think that this is what is really important in everything that Karen and Kathleen just shared right now, is the ability to be able to constantly partner with philanthropy, recognizing that often philanthropy is more nimble, often philanthropy has a seat at the table with our community partners, and that at the end of the day, it's about breaking down silos. And I think that's what makes this position key to all the work that we're trying to accomplish in this administration, is the ability to, for me to be able to cut across all the deputy mayors' portfolios, to really look at subject matter experts, to look at the work that philanthropy is already doing on funding, and for the mayor's office to be able to partner with that work. I think often, you know, we try to reinvent the wheel, right? Or we work in silos. When I first started my career at United Way, the big buzzword was collective impact, if folks remember that. And often what lacked in collective impact was the institutional knowledge of government partners at the table. And so when I was doing my place-based work, you know, we were able to bring alongside community, we were able to bring alongside community-based organizations, you know, a variety of different stakeholders, and then we would struggle to bring government along. And I think that this is why this role is important, because we want a seat at the table at the beginning, or to at least say, hey, we know you're doing this amazing work. We're not trying to create another series of work or community conversations. How can we all work alongside one another? And so, you know, COVID, I think, was a great example of how philanthropy can move quickly and nimbly, but also at the end of the day, having that partnership with government was key to be able to address all the societal issues that COVID really brought to the forefront. So I'm happy to be on this call and, you know, really looking forward to the conversation today.
Thanks so much, Jackie. So now I sort of want to have a bit of a conversation with both of you, Kathleen and Karen, about your amazing experience at the state level in Michigan and in California. And I think one of the things that I'm sure a lot of people were most excited to hear about were some of the successes that you've had in developing these partnerships. And you touched a little bit on them in your introductions, but I think that as we dive into sort of this conversation, a great way to start is just to talk about even more like the promise of what partnership can bring that either philanthropy or government might not be able to do on their own. So I'd love if each of you can sort of talk a little bit more about some examples that you've seen in your work of what when that's happened, and maybe how that could be brought to Illinois as well.
Happy to start, Alex. I'm going to mention maybe 2 or 3 quickly partnerships. The first one is our most long-standing partnership, and that's early childhood. And we're grateful for the Joyce Foundation for helping us to kick that off. When I first came into this role, probably a year or so in, the Joyce Foundation did a learning tour and listening and learning tour in Michigan. They support the Great Lakes area, so Michigan is one of the states they support, but they had not been very active in. And they were excited about then Governor Granholm's interest in early childhood. At the end of the learning tour, they told a new education advisor that while they appreciated the governor's excitement, Michigan wasn't ready. And the stakeholders were all over the place. The education policy advisor shared that with me, and I asked her if she minded if I contacted the Joyce program officer. And I did listen to the conversation, said, I agree with you, they are, but would you help us with a planning grant? And Joyce gave us a $25,000 planning grant to hire a consultant to really work with the stakeholders to come up with a strategy for Michigan in early childhood. That led to an over $1 million, I think it was 1.2 or $1.4 million planning grant from Joyce to continue the work. And it engaged others across the spectrum in Michigan, from the small family foundations and community foundations that didn't have a particular expertise in it, but were interested, to the large foundations like W.K. Kellogg Foundation, which had a portfolio and experts on staff in that area. And that has continued. The Kellogg Foundation president was able to say to the next governor when we were talking, no, it's not about it's about early childhood. It's about prenatal. And it went into his state of the state. And this was a Republican governor. And then it has gone over to this governor, who is now actively pursuing it. And that the Democratic governor got it started. There was a challenge grant from Kellogg that said, if you put $1 million Michigan legislature in, I'll give you $6.5 million. They did that. The Republican governor then put $50 million in. And now we are putting, I think, over $150 million a year into early childhood in our state with another Democratic governor. So that, because of our office and because of the way we continue to engage in this subject matter with the state agencies and the governor's office, we've able to raise the visibility and the importance of early childhood. Quickly, for another one, more recently, the state wanted to do some CVI work, community violence intervention work. They decided to put a new office into the Michigan State Police. It was philanthropy said, that won't fly. The folks who are doing community violence intervention work often are people who have had previous involvement with the justice system. They will not be comfortable working with the state police. So it was philanthropy that pushed with our help and our connecting the right members of philanthropy to the governor's policy advisor to move it to the Department of Health and Human Services. So that's just two examples.
Happy to jump in. I feel like with so many public-private partnerships to choose from, it's like asking me to choose my favorite child, which never stops my children from asking me anyway. But I'll just mention one that I think is really illustrative of the fact that, like, we're talking a lot about philanthropy and engaging community-based organizations. Public-private partnerships can also be about engaging companies and bringing the best of the private sector and all resources to the table to solve really hard problems. And in our state, housing, like in your state as well, I'm sure, is a really one of our biggest, most pressing problems. And so Governor Newsom from the beginning was engaging the private sector and in trying to think about how can we develop affordable housing in new ways in our state and get housing up more quickly. So we had roundtables with companies, CEOs. I did a series of community meetings across the state with community-based organizations. We had those organizations in the Capitol, in the governor's office, to do a kind of brainstorming exercise to solicit the best ideas. But we didn't really have the opportunity until during COVID, when the state was shut down during the pandemic. Thousands of people were living on homeless shelters throughout the state, when one of our biggest concerns early on was the spread of disease in congregate settings. And so since tourism had stopped, we simultaneously had this opportunity where we had all of these rooms available in hotels and motels. So California used FEMA dollars to pay for individual rooms for people who are experiencing homelessness. As the nightly costs of those rooms stacked up, Governor Newsom had this brilliant idea of, why don't we just purchase these hotels and motels and use them permanently for transitional housing? And so he dedicated an unprecedented $3.75 billion from the American Rescue Plan toward buying these motels. But the local jurisdictions weren't sold, because they knew that you can't just buy hotels you have to have services around it. And that was something that the local jurisdictions were going to be responsible for. We engaged philanthropy because of the relationships that Governor Newsom had built through these one-on-one conversations with CEOs, through the roundtables we did with philanthropic and private sector. We were able to draw on those relationships to raise $65 million from Blue Shield, Kaiser, Hilton Foundation to support not just social services like mental and health and substance abuse support, job training, counseling to get into more permanent homes, but also to support the renovations to make these motel rooms more habitable on a long-term basis. And so I think it's a great example of where you might say, okay, $65 million is a lot of money, but it's not a lot of money compared to $3.75 billion. But what it was critical for was de-risking. It was that risk capital that allowed the local jurisdictions to be bought into the policy idea. And as a result, HomeKey was able to fund 219 projects totaling over 13,000 housing units for California's most vulnerable residents, more housing that had been brought online more quickly than ever before. And it saved 138,000 families and individuals from homelessness. The biggest innovation here is that the per unit cost was $138,000 for each unit, which is significantly lower than it, on average, it costs about $500,000 to bring a housing unit online in California. So what I love about this example is that it's both helping real people, individuals who no longer have to live in homelessness, but it's also about changing systems. And as my former colleague, one of the governor's most senior housing advisors said, because of HomeKey, we will never again build housing in the same way in California. That is the power of public-private partnership to catalyze that long-term system change. And that's what gets me so excited about the work.
Those are both incredible examples. Thank you so much for sharing. I think those are really illustrative as to the power that this work can have. And I think one thing that both of you sort of hinted towards as you talked about them is that the conditions needed to be right. It wasn't just like immediately everything is ready to go and we're just going to do this. So I'm curious if you could talk more about what sort of those conditions are that you see for successful partnerships, what muscles need to be built both in government and in philanthropy for people to be ready to engage in this kind of work, and what maybe we can do to sort of build some of those muscles.
Well, I think I'll give you another example that might illustrate what you're asking. Dana Lilliane and I spent considerable time about a year and a half ago working with the State's Department of Natural Resources, who oversees all of the parks and recreational resources of the state. They had gotten $65 million from the ARPA dollars to support individuals who had been adversely affected by COVID. And they were trying to figure out how to spend it when their structure was one of a state parks board that tended to fund very highly organized groups across the state, associations and groups, but had paid little or no attention to who didn't have access, the equity question. So Dana, because they were trying to figure out a new way with some different funds that gave them more flexibility than their traditional pots of funds did, we were able to spend time with them talking about how to create a more equitable way of working. They had hired some consultants who were familiar with our office, brought us in early to say, we think community foundations could be helpful here, but we're not sure. We helped them structure a way to engage with community foundations. We helped them create a heat map that really identified the communities and sub-communities that weren't being served by them. and creating indicators around, the income of those communities, the health and well-being of those communities, and the access of those communities. And as and they are working now with the Council of Michigan Foundations and a group of community foundations to provide not only the opportunity to apply, but also to provide the technical assistance and support that the communities will need in order to be successful applicants to this process. So they peeled off $25 million of that $65 million to go to the Council of Michigan Foundation to work with community foundation. So having the federal funds, having the Council of Michigan Foundations being willing to be a manager and fiduciary of the project was, and having a department that says, we know we haven't been giving out money, grants in an equitable manner across the state. Those were the conditions that were necessary. One quick other example for you. About a year and a half ago, the governor's office approached us and said, this is a confidential conversation. We want a population study, a demographic study for Michigan. We don't want our hands on it. We think we need to look to 2045, 2050 and say, what is it going to look like then? And what conditions do we need to be creating now to have a thriving Michigan in 2045 and 2050? We took that to our advisory committee and said, what do you think? They saw a huge opportunity in it. Like Kathleen said, to not only have something for state government, but to have something for philanthropy and business, so that maybe for the first time in Michigan, that they were acting on a sane set of knowledge and information and data to drive policies to make Michigan successful. That piece has been a catalyst for so much over the last year, that had not the governor said, I don't want our hands on it, she could have done it, but it would then been a Democratic piece. Because of our nonpartisan status and our reach, we were able to raise over $650,000 to fund this study using 2 Michigan consulting firms and with an equity lens on it as well.
Yeah, I couldn't agree more, Karen, that it's sometimes it's like the non-sexy stories that are really what's most important about this work, working in community, the data to show that programs are actually having an impact. The one thing I'll add is that this work doesn't have to happen alone. You have to have the infrastructure and support necessary to move these partnerships forward. And in California, my role as senior advisor was so critical to advancing partnerships. I worked so hard running around this state. I think I put 20,000 miles on my car in the first 6 months in the job. I remember one time driving 5 hours to Bakersfield for a community meeting and then coming back the same day to put my kids to bed. I mean, that's the level of commitment and dedication that I personally had to community, to ensuring that our public-private partnerships were grounded in community. And that when I was in the governor's office and playing that translator role for my internal state government colleagues to be able to help them understand the philanthropic goals and opportunities, I was fully aware of what those opportunities were, and I was a connector internally and externally for philanthropy. So having that liaison position, I think if you're looking to build something in Illinois is mission critical. Additionally, Philanthropy California, our membership organization that I mentioned before, was critical to advocating for my position. So that's another role that you can play at Forefront, is really advocating to the governor's office that this is important work and why. And then I would say, you know, for me personally, as I mentioned, I think having being a lone wolf in the governor's office and, you know, having a direct line to the governor was really critical to getting the partnerships end, but it also meant I had zero support. It wasn't like I was sort of building a big office internally. For me, having an external support system through philanthropy funded Friedman Consulting, a consulting firm with expertise in public-private partnerships, where I'm now a senior advisor to help identify opportunities and host partner convenings and create strong lines of communications with government. That kind of external support was also really important in my role. I feel lucky to now be a part of Friedman Consulting as a senior advisor, helping other states to build their own initiatives. We're working with Governor Moore in Maryland to build his social innovation office. And we're also working on a much larger nationwide effort called the State Partnerships Lab to support other governors to advance public-private partnerships in their states. We hope that Illinois will be one of them. Because I truly believe that public-private partnership and governing in partnership is the way of the future. And my dream is that all states will have these liaison roles like Michigan, like California, so that every state can be governing in partnership.
That's super helpful from both of you to hear your experience on this. I think though, what I don't want to do is paint this as a panacea and just perfect and not hard at all. So I'm curious if you could then talk about some of the challenges that you've experienced in doing this partnership development work. What things have been struggles for you in your roles in your states, and maybe like some landmines that we could hopefully avoid as we advocate to do similar work here in Illinois.
Well, I would say a couple of struggles is both philanthropy and state governments say they want to partner, but often don't want to change. Okay. And partnership, as we all know, partnership, whether it's a personal partnership or a professional partnership, it takes adjustments. It takes willing to hear and work with the other side openly and candidly. So that can be a struggle. And just the time it takes. That was probably my first lesson in this, is it takes time to build an effective partnership or collaboration. You got to build a trust in. Someone has to trust. Sometimes the trust is they trust our office. They trust us and that's why they engage in the partnership. But time, a willingness to change and adjust, and a willingness to focus on the communities, the families, the kids in the schools, and not your organization. Not your mission, not your state policy, but to really focus on who is going to be impacted by this. Who's going to hurt, who's going to be harmed, and who's going to be helped? Is it equitable? And to really force the conversation to open up in different ways than that. So that to me is one of the challenges. Transitions are challenging. We have transitioned twice. And they are challenging because each governor comes in with a different frame for how they want to administer and and what their goals are. You know, we often lift up different funders and to talk to them about the office. So the same folks who might have been in front of Governor Granholm were not in front of Governor Snyder pitching OFL. You know, so we have to be cognizant of that. The other thing is, like Kathleen pointed out, we are a small office. During most of my time, it's only been two of us. Sometimes it's been a third person. And we have 17 state agencies, state departments. We can't be all things to all people. So just the breadth of what is possible based on the resources and what you have, and being able to simply say sometimes, we're only going to focus on these. We don't have the capacity to focus on these other things.
Yes, ditto all of that. I would just add, I think one of the biggest challenges is the lack of urgency. I think one of the huge benefits that I had during my tenure, I started in June of 2019. None of us knew what we were signing up for at that time. And the COVID-19 pandemic really catalyzed this sense of urgency around innovation, around moving quickly to save lives in a way that was catalytic to partnership, because government couldn't move quickly and they needed the private sector. So how do we create the same level of urgency around longstanding crises like poverty and homelessness and climate change, I think is a really big question. I can run through a few others. Conflicts of interest are a big challenge, both real and perceived conflicts. This is not a pay to play. This is really important to kind of keep those clear lines between partnership and advocacy. Like Karen said, a lack of capacity is a really big barrier for governments to engage. One of the things that we did in California, because as I was thinking about my own transition, I wanted to make sure it wasn't just reliant on having someone in the governor's office. So I worked with Governor Newsom on an executive order to appoint agency partnership liaisons in every single department and agency in the state. So that means that they're all out doing partnerships as well, and that helps with capacity. I think even capacity in philanthropic and community-based organizations, this is a two-way street, right? So internal in government, they have to have their liaison structure, and community-based organizations and philanthropic organizations need their policy leads to be constantly kind of working with government and building those relationships. I agree on the lack of motivation to do partnerships. People are busy. Like, people are just trying to do their work and they don't have time for new things. So I have a lot of empathy around that. And yet I think it goes back to, yet again, the reason why you need a liaison to help make it as easy as possible for people to get engaged. And finally, the political factors are critical. And whether it's elections, we faced a recall election for Governor Newsom during my tenure, and that put some of our partnership work on hold because we just had to be very politically safe during that time. In California, we haven't yet experienced a transition of administration, as Karen has so masterfully done in Michigan over the years. So I think these are all considerations. There have been other states that have had liaison roles in the past, Ohio being one of them, that no longer does because of transition. So we need to be thinking about how do we set this work up for the long run.
Amazing. And I know we're running towards the end of the time for this part, but I want to really quickly ask both of you just to touch on sort of a more technical aspect, but that I think is important as we think about how to bring this over to Illinois is how each of the offices that you work or worked in were sort of funded and structured in that way, and how that impacted the work very quickly. And then I want to turn it over to Jackie after that.
The Michigan Office of Foundation Liaison was intentionally structured as a nonpartisan office. It also was intentionally designed to work only with the executive branch of state government, not with the legislative branch. The Council of Michigan Foundation's Forefront's counterpart in Michigan has a legislative side that they work on behalf of Michigan Philanthropy. Like I said, our budget is funded by a group who is also our Foundation Liaison Advisory Group. They are long-term funders by choice. And they are senior leaders in their foundations. So they have been our backs at times, Kathleen, when we were up against an election and we knew that what was going on, we couldn't do then. So they have been strong advocates for the office, as well as supporters of the various projects that we've worked on. And so that has been critical for us, the governance, the leadership. And they continue. One of the creators of this office, who wrote the design on the back of the cocktail napkin for then Governor-elect Granholm, he served for 17 years as our chair of the advisory committee by choice, because he believed in the office so strongly, and still serves on the committee. So that deep commitment from philanthropy for the office, stable funding and nonpartisanship, I think, are three keys for us.
So my salary was paid for by the governor's office. So I was a full-time staff on the cabinet team in the governor's office. The external support of Friedman Consulting was paid for by philanthropy. So it was a little bit of a balance there. And I think, although we don't have a formal advisory structure, as Karen's mentioning, I think those folks who are invested externally, some of the top foundations in California, will be critical as we think about transitioning when Governor Newsom is ultimately transitions in after the election in 2026, he'll be termed out. We have had a transition in my role. I left after 3 years, and our new liaison is Elena Chavez Quesada, who has done a tremendous job, and I think is really showing the proof of the potential of transition, even across administrations.
Thank you both so much. And thank you for donating your time to Illinois today and helping us learn more about your work in other states and what we can bring here in Illinois, hopefully. So thank you both so much for your expertise. And I know we're going to have questions later in our program, but I want to turn it over to Jackie to talk more about what she's already doing in Chicago in this same kind of space and share more about her work. Go ahead, Jackie.
No, it's so funny. I'm listening to Kathleen and Karen, and I'm like, oh my goodness, this is the future of what I think the role right now that I have is. And I'm just so inspired by all the things that you all talked about and really like institutionalizing this and building up the capacity. Because right now I am a team of one. So I definitely hear you on the consultant piece. So I want to talk a little bit about what I've been working on. Like I said before, this role has never existed in the way that it is now, where it's formalized. There's been, directors that have worked very closely with philanthropy. Again, philanthropy's always been very interconnected in the mayor's office, and in Chicago, I would say we have a very strong philanthropic community, right? That's very involved and is very proactive in community. So I think that that's one of the things that I'm really grateful for, is being in philanthropy, is seeing sort of the commitment to community and authentic relationships that have been built. And so I think what's exciting about the role that I'm now in is that I'm able to bring that lens to the work that I'm trying to accomplish here at the mayor's office. And so I think the partnership piece that everyone keeps talking about is very real. It comes with challenges, of course, because I am in the mayor's office. Again, we can, the politics are very much there, but at the end of the day, I think that, Chicago's philanthropy is very committed to improving the quality of life of all Chicagoans. And I think that being able to have a point person at the mayor's office that's able to give them really insight into what's happening on the government side is key to all of this. So one of the things I've been spending a lot of my time on is working with new arrivals. Chicago has had about 33,000 new arrivals come to the city in the last year, primarily from Venezuela. So we are dealing with what I would call a humanitarian crisis that Chicago has not seen probably since the Great Migration. And I want to actually thank a lot of our partners that are on the call today. I would be remiss if I didn't give a shout out to Maria Pesqueda over at the Healthy Communities Foundation, who has been very instrumental in doing a lot of rapid response to the migrant mission. And I bring up the migrant mission and new arrivals. And actually, Kathleen, as you were talking about the hotels, that very much sparked an idea that we do have currently going in the mayor's office right now is, we were not expecting this. I don't think anybody was. I think the nation is facing this crisis right now in a way that is testing our limits to how we handle our shelter and unhoused population. And so I think that in Chicago, we've known this to be a problem. We know that, our shelter system is not as strong as it could be. And I think that now 33,000 people arriving in the last year has completely exposed just how weak our shelter system is and our housing system is. And so I think this, back to this COVID, right, is a point in time where it's almost like the perfect sort of conditions to create new systems and structures and long-term sort of sustainability to support all individuals, regardless if they're coming from another country or if they're experienced unhoused because of other conditions here in the city. And so we're really using this as a moment in philanthropy and in the mayor's office to think about long-term solutions to housing. So, but in the way that we're working right now with philanthropy is really around rapid response. And so, one of the things that, as everyone has already mentioned on this call, unfortunately, sometimes government does not have the ability to move quickly enough to really meet people in a humanitarian crisis. Never in my life have I heard the word procurement so much. So every time that we're trying to do something, we're like, oh my goodness, we have these hundreds of people that just arrived on this bus. We don't have anywhere for them to go. We're not ready for this. It's been very challenging for a multitude of reasons. And so very grateful for our philanthropic partners that have been able to quickly mobilize and provide the basic needs just to hold us over until government can kind of figure out what the next step is, right? Because we just do not have the ability to move as quickly as we would want. That's not to say we haven't moved quickly. I think that this is very unprecedented for Chicago. We've opened up 27 shelters in the last year. That's not happened before. So, and again, these are all things that are lessons learned and are testing the ability of both government being able to meet a crisis in partnership with philanthropy. And so, a lot of the work right now that I've been doing is really creating those rapid response partnerships, right? Anything from food to, hygiene kits to diapers to, all those things that we often take for granted, and getting them into the hands of the new arrivals has been very important. But I also want to thank philanthropy for really committing to doing solidarity work, right? Which is something that is very crucial in this moment, where you have folks very rightfully saying, hey, I've lived in Chicago for a very long time, and I have unfortunately lived in a community that has been under-resourced, right? And now you are all spending all this money on people that just got here, right? Some of that is false, not necessarily true, but I can very much see how a lot of communities are feeling in this moment when they see what they believe to be people, getting in front of the line of them, right? And this is not just, this is cuts across all communities. Even, people think often like, oh, well, Latinos in Chicago should be very welcoming to the Venezuelans because they're all, they're all coming from, Latin America. And the thing is, we're not a monolith. And also people that have been here, again, Latino community that has been here for quite some time, that is undocumented, is also feeling, like they haven't had the same opportunity. So all of that to say is that, government really is relying on philanthropy right now to really create that solidarity work, to be able to fund community conversations, authentic community conversations, to build that trust. Because that's the other thing that we recognize. It's obviously we need to improve our shelter system. Obviously we need to improve our housing system, but in this moment, the new arrivals are sort of opening that up to happen, but it's really about building it for all individuals that are experiencing this, regardless of why they are, right? And so I kind of want to pause there. That's a lot of the work that's happening right now in terms of the partnership with philanthropy. Being able to do briefings in real time has also been crucial to getting the information out there, the messaging out there. Tomorrow we have a funder briefing focused specifically on, unfortunately, we had a case of measles, a variety of cases of measles in one of our shelters. And so our Chicago Department of Health has been on the ground almost 24/7 since the first case was identified, really working to mitigate and to ensure that all new arrivals now are being vaccinated for measles the minute that they arrive. And so being able to have a funder briefing with philanthropy, with funders that are specifically focused on health and wellness is, again, going to be key to ensuring that we keep Chicagoans safe and that we're able to really respond to things like that in real time.
Awesome. Thank you so much, Jackie. That is super helpful to hear about what you're working on. One thing I want to make sure to ask you about that as well, and about your sort of role as you've settled in over the past 7 months, is sort of what concerns you have for the future in terms of the sustainability of your role, and what can Forefront, what can foundations in the philanthropic sector do to ensure that the work that you're doing now continues in building those connections between philanthropy and both local and hopefully state government as well.
Great question. So I think similar to Kathleen, I am a cabinet member, so I am part of the mayor's office cabinet, which is also, I think, very important and very key. I have a direct line to the mayor and senior staff, which makes things a lot easier in terms of the bureaucracies here. I'm also very much connected to all of our city departments. So our commissioners, again, being able to have a direct line to our Commissioner of Public Health, Dr. Ige, in this moment has been crucial to making those connections with philanthropy. So I think that, you know, one, in terms of sustainability, I strongly believe that regardless of the administration, this needs to be a senior level cabinet role in order to be able to quickly mobilize and move things. I think secondly, capacity, I think, is my biggest challenge right now. I am, again, a team of one. And so I'm really happy to hear Kathleen's example of contracting with a consultant. You know, we, unlike other cities, we have a very small mayor's office. And I think that people don't realize that, you know, we're a small but mighty crew over here. And so I think that being able to build up that capacity is going to be crucial in terms of how we're able to really support efforts across the board, right? A lot of my time right now is being spent on new arrivals, and that's because this is very much, you know, changing constantly and is a high priority. But, you know, I do spend time working on public safety, education. We're doing this great initiative with the Dolly Parton Imagination Library. So there's a variety of things happening. And I think that the more that I can build out systems and really think about, you know, key positions in other departments across the city and how we connect is going to make all of this very sustainable. And then again, having a counterpart like mine in the governor's office, I am all about. So however you all can make that happen, I would be very excited to see that. Again, especially because a lot of the work that we're doing right now, back to the new arrivals, we're in constant conversation with the governor's office, right? Governor Pritzker has been very much working on this humanitarian crisis from the moment that the new arrivals, you know, from even a year ago, right? And so being able to have a point person in the governor's office, I think, would be very crucial in moments like this.
Amazing. And the other thing I just want to quickly ask you is you sort of touched on is that the new arrival crisis that I know you're spending so much time on is impacting Chicago a lot, but it's also impacting across Illinois. And I know we have people on from across the state and not just from Chicago. So I'm wondering if you can touch on like what you've seen as the necessary statewide response, both in government and in philanthropy, and what you see as the needs there.
Yeah, absolutely. So I think that one of the things that a lot of other folks in Illinois are experiencing is they've had new arrivals come to their, you know, their towns, their suburban region. And again, I think I saw someone, Tony here from Oak Park. Oak Park has been a crucial partner in supporting new arrivals, right? When Chicago, there was a moment where, you know, we didn't have all the shelters open. And unfortunately, a lot of the new arrivals were staying in police districts, which is absolutely not the route to go, right? And luckily, Oak Park was able to step up and really help Chicago out and be able to support some of the refugees out in Oak Park and be able to, again, create systems of care. And so I think that, you know, it's new arrivals tend to come to Chicago, obviously, because we are a big city, but being able to have other municipalities, other suburban regions support this mission has been crucial in really meeting people where they're at. And so I think that more of that, I think right now what's lacking is the coordination. Again, back to this long-term piece, back to the systems piece. I think that this is something that we are very much working on in the mayor's office right now. We have working groups coming in online. I think that, you know, things have been moving so quickly. Right now, we're lucky that we've sort of seen a decrease in buses arriving, which gives us the opportunity to think about long-term planning. But what I'm really grateful for is the fact that, you know, not only in the mayor's office, but our philanthropic partners is seeing this as an opportunity to really think about our long-term sustainability of our shelters, of the city being able to support people in crisis, regardless of the crisis. You know, one of the things that I've been talking to philanthropy a lot is climate change, right? The climate crisis is here, and we will continue to see an influx of people coming to Chicago because of climate change. And so how do we continue to support people? How do we build these systems up so that we're not constantly reinventing the wheel anytime a crisis happens?
Awesome. That's all super helpful to hear. At this point, I want to open it up. We have so many smart people in the room from across our state. If others have questions, I want to invite them to either chime in through the chat or raise your hand and speak up to ask any of our amazing speakers a question about their work and what we can do here in Illinois at the state level. Don't be shy. But if nobody has questions, let me give it one more second. I can turn it over to Maria to talk more about what's next and wrap us up here. Go ahead, Maria.
Great. Thanks, Alec. And thank you to Karen, Kathleen, and Jackie for sharing each of your journeys with us this morning. We've heard about the value of formalized partnership structures, and we certainly understand that with everything happening in our state, including supporting new arrivals and the possibility of a more austere state budget in the coming years, we know it's important to align the resources and efforts of philanthropic and state leaders. We've learned today, as we've known from other states, that philanthropic leaders must be invested in these partnerships for them to be effective. We know we have state leaders in office that understand the value of philanthropy and have shown an interest in partnering with us in various ways. But we also need to be sure that these paths of communications are strengthened and scaled so that they do outlast all of us and stretch out into the future as leadership changes. So I'd like to invite you all to join me in the Healthy Communities Foundation to take a couple of concrete steps. First, please send Holly and Alec your remaining questions, if you have any, and be sure you're signed up for Forefront Communications to stay in touch. And secondly, and most importantly, Forefront will be circulating a letter following this event that we hope that you'll sign on to. This letter will ask Governor Pritzker for a meeting so that we may discuss the how to formalize and strengthen partnership efforts in our state. And Forefront will take the lead on any related policy implications. The letter will be designed to ensure that foundations that do sign on are not violating rules about lobbying. So keeping in mind all the private as well as public philanthropy rules. So thank you, Forefront, for keeping that in mind. And please join me and others that are committed to this work and want to see it continue. We feel that we're certainly at a ripe moment here in our state to make this happen, and appreciate your time this morning and your commitment to this work. Thank you, and we'll be in touch soon. Again, thank you so much, Karen, Kathleen, and Jackie, for your time and for the Forefront team to make this happen today. Appreciate it.
Thank you so much for having us.
Yes, thank you. It was a wonderful opportunity to talk to you. Wish you the best as you move forward. And we're happy to continue to provide any kind of conversations that might be helpful to you.
Thank you. Appreciate it. Right. With that, have a great day. Thanks.